Hello, YouTubers. Welcome to my channel, Lady Nephrology, where we talk all things nephrology. Today, we have a special guest. We have the fabulous Cheryl Haynes, and she will give us some insight on COVID-19 and how it affects the kidneys. Cheryl Haynes, she is a wife, mother of two beautiful children. She has her BSN and MSN in nursing informatics. She has 27 years experience in nephrology, working in the acute hospital setting, chronic outpatient dialysis clinics, and research dialysis. So welcome, Cheryl, to Lady Nephrology. How are you doing today?
I'm good. And yourself?
I'm doing wonderful. So this is really a hot topic right now, COVID-19 and how it affects the kidneys. So we're gonna just dive right in, okay? Is there anything you would like to say before we start?
Yes, I would like to say thank you, Kenda, for inviting me to your platform today. I really appreciate that.
And thank you for being here. I appreciate that. We need people like you and your expertise on this subject matter. So let's get started. What role does the kidneys play in your body?
First of all, the kidney is a very important organ of your body. It plays a role as homeostasis of the whole body. This means it manages the fluid levels, the electrolytes, and other factors that keep the internal environment of your body consistent and comfortable. Your body kidneys actually filters about 200 quarts of water a day, of blood in a day, which equals out to 1 to 2 quarts of urine. So the urine contains waste and extra fluid, which the kidneys get rid of. So when your kidney is not working, you're maintaining those toxins in your body. So that's why it's important that you get your checkups, your physicals to make sure your kidneys are working properly.
Right. So COVID-19, is that a possible, does it possibly damage the kidneys?
That right now is a big issue that we're having. A lot of the patients in the hospital that are being admitted are getting AKI and chronic kidney disease from COVID-19.
And what is AKI for people who don't know what that is?
Acute kidney injury. And that's reversible.
Okay, and the AKI is reversible. So how do you think that COVID-19 is damaging the kidneys?
What is happening is that COVID-19, the virus itself, infects the cells of the kidney. And then what happens after that is kidney cells, they have what we call have receptors. So it attaches to those receptors and then it damages those receptors by producing abnormally levels of oxygen. If this involves the lungs where you're having lung issues, or they may have blood clots, which attach to those receptors. And those blood clots that are attaching to those receptors are causing those kidneys to become damaged and they lose kidney function. It could be an AKI situation or chronic. It depends on how bad it has affected the kidneys.
So where you live in Florida, are you seeing a lot of kidney damage caused by COVID?
Well, as everyone know, most people, is South Florida has a big population of COVID-19 diagnosis. So what that means is people have been testing at the testing centers and they've been testing positive. And we have considered large numbers of positive tests here in South Florida. So yes, I am seeing a lot of AKI and chronic patients due to that fact that you have a bigger population of positive patients.
And so are you seeing more acute cases where the kidneys recover or more chronic cases where patients have been placed on dialysis?
Both. I've had AKI and some chronic patients. In both situations I'm seeing.
With the AKI, they go on dialysis for a little bit and then they're able to get off?
Yeah, most of the time what happens is we put them on dialysis and they'll dialyze for a while and we'll check their labs to see if anything's changing. And then based on what the doctor diagnosed them, as far as their weekly labs, and a lot of times they're off like within a week or two.
That's good. So how are the dialysis units affected? Is there specific clinics that's dedicated to COVID patients?
They are, depending on what clinic it is. It could be a DaVita, Fresenius, Pure Life, US Renal Care, depending on how the clinic is made. Some clinics are dialyzing their patients on a different shift. Some are dialyzing them on the last shift of the day, and some have isolation rooms. So it really depends on the clinic.
And do you feel that underlying conditions such as high blood pressure or diabetes increase the risk of kidney disease in the COVID patients?
Well, high blood pressure and diabetes is considered a chronic condition. So yes, it does, because you're more immunosuppressed due to these conditions. So you could possibly get COVID-19 much easier.
Yeah, and in the regular population, high blood pressure and diabetes are the two top causes of chronic kidney disease as well. So I can understand
Yes.
that can be even more in the COVID patients. So what are some side effects tied to COVID that might play a role in acute kidney injury?
Side effects is pretty much the same type of side effects you would have if you had kidney failure. So we're talking about like swollen legs, swollen feet, short of breath, confusion, nausea, um, fatigue. Pretty much the same symptoms you would have if you were, AKI or chronic kidney patient. So it's the same thing except you're COVID positive as well, which have caused the disease. So it depends on the severity.
And so what are some steps that patients can take to protect themselves?
Well, as recommended by CDC, we have to maintain social distancing, wash your hands, wear your mask, um, try to protect yourself by just staying pretty much to yourself. But with you having underlying conditions like that, it makes it really hard because you have to come to dialysis 3 times a week. So you're going to be among other people. So that's another factor.
And so any final thoughts or comments that you have on this subject of COVID-19 and kidney damage?
Yes, I would say that COVID-19 is a serious disease, and everybody needs to protect themselves and others by maintaining social distancing, washing your hands, using your mask. Also,
Do you recommend getting vaccinated? Do you
yes,
recommend patients
definitely,
get vaccinated?
definitely get vaccinated for those people with immunosuppressed systems, and also doing your booster shots as well. That's a new thing.
All right. Well, thank you so much. So we're going to share a little bit of your presentation here. Let's see if I can share it real quick. So this is kind of presentation about the kidneys and COVID-19. And if you want to add something as we're going through, just feel free if you want to add anything. This is basically explaining the role that the kidneys play in the body, which Cheryl already discussed. And that's a little kidney there, how it looks. And
And that's
what's a wet bed?
the wet bed is pretty much describes what the kidney does as for it maintains high blood pressure, control high blood pressure, produce the hormone erythropoietin, which helps maintain a healthy red blood cell count, activates vitamin D, remove toxins and waste, which we mentioned earlier, maintain control water balance, and control acid-base balance. So these are the things that the kidneys regulate and do in your body.
Right. Go to the next slide. So half people hospitalized get an acute kidney injury. That's a lot. That is a lot. And it can happen pretty suddenly, within
Yes,
hours or days.
definitely. Can happen up to 2 days to weeks. And that's even if you're not diagnosed initially as a chronic patient or AKI patient. So that's pretty severe.
Yeah, it is. And this is about what we already talked about, how COVID is damaging the kidneys. Oh, you also you didn't hit on the low oxygen levels.
Yes. It can cause abnormally low levels of oxygen because of the lungs are being affected, and a lot of people are getting pneumonia and from the COVID-19.
And you are in South Florida, kind of close to the Miami area. We already discussed how the dialysis units are affected. Yeah. Can you touch on this slide here, how high blood pressure damages the kidneys?
High blood pressure damages the vessels of the kidney. And what happens is this causes a hardening of the kidney inside of the glomeruli. And then it's kind of like just causes a clot there and shuts it out. And then your blood pressure goes up, and then the kidneys can be shut down from that.
And then we already talked about some of the side effects and what acute kidney injury is. We already touched on that. Then sometimes reasons for the acute kidney injury, the low blood pressure, blood loss, heart attack, organ failure. And also we like our patients not to take NSAIDs because they are very bad for the kidneys. So we recommend patients don't take NSAIDs.
Yeah.
Which those include like ibuprofen and naproxen and Aleve.
Yes.
She already touched on some of the side effects, the swelling in the legs, fatigue, shortness of breath, confusion, nausea. Those are all symptoms of acute kidney injury and can be with chronic kidney disease as well when they're getting closer to end-stage renal. And did you discuss some of the tests that are done for acute kidney injury?
We didn't discuss that. So some of the tests that can be done are your creatinine, and your creatinine usually is high if you're in AKI or chronic. Your BUN is high, your albumin is low, your hemoglobin is low, your GFR is low.
Which that's the glomerular filtration rate.
Filtration rate, and that just tells you the estimate, the amount that the kidney is filtrating your urine and toxins out of your body. And that normal number is usually greater than 60. But if it starts going down as kidney damage is getting worse. But with COVID, it goes down just that fast.
And also kidney biopsy, you can also diagnose with a kidney biopsy. And the treatment for acute kidney injury in the hospital?
Dialysis. They usually do dialysis. Now, they did some CRRT for some patients that have like other comorbid conditions, or the dialysis is too much for them. So CRRT is like a slower dialysis, and it just does it 24 hours where they take off a little bit at a time. So it depends on the patient's condition.
And we already talked about the steps that patients can take to protect themselves, getting vaccinated, social distancing, wearing masks. All right. Look how beautiful that picture is. Okay. Well, thank you so much, Cheryl. I appreciate your time, and I appreciate you putting this education out to patients who will watch and see how important it is, COVID-19 and kidney damage. Well, thank you so much for your time, and please like, subscribe to my channel, and we'll talk to you later. Bye-bye.
All right. Thank you.